Rogers TV.
Hello, everyone. Welcome to Health 180 with Carion Fenn on Rogers TV and podcast. My name is Carion Fenn. Today is March 21st, 2022, and my guest is Shan Mei Young Tai from Daya Integrative Health. We are exploring Ayurveda and Nurse Practitioner. We want to help you learn more, so let's learn together. Shan Mei, welcome to our show.
Thank you so much, Carion, for having me.
Tell us about yourself.
So I am a nurse practitioner. I've been a nurse for about 22 years, and I've been a nurse practitioner for about 6 or 7 years this year. So I'm a nurse practitioner. I'm also an Ayurvedic practitioner. I'm a medical cannabis consultant. So my approach to care is very integrative. It encompasses Eastern medicine, Western medicine, and how to bridge the two for the best outcomes.
For those who may not know, what does a nurse practitioner do?
So a nurse practitioner is a registered nurse who has had additional education, experience, and has passed provincial exams and requirements in order to have an advanced practice. So as a nurse practitioner, you can do advanced assessment, you can give a diagnosis, you can order labs, you can order imaging, write prescriptions, and you basically can be a more independent practitioner than a registered nurse can.
How long have you been doing this?
So I've been a nurse practitioner now for 7 years, after having been a registered nurse for 15 years prior to that. My specialty is family practice. So as a nurse practitioner, I'm a primary care provider, and that encompasses all ages.
So what are some of the environments in which you worked in? Have you been doing just private practice or?
So I've worked in a huge range of environments. As a nurse, I worked in acute care in hospitals, ICU, public health. I've worked within primary care clinics. And as a nurse practitioner, I've had a family practice in the past with patients of my own. I've worked in long-term care, and I've recently transitioned to a private practice where I'm providing integrative care.
How many years does it take to be a nurse practitioner?
So you've had to have been a registered nurse for at least 2 years or a certain number of hours. The program takes 2 to 3 years, depending on if you do it part-time, full-time, but the maximum time that you can take is 3 years. It involves doing a master's of nursing science concurrently with the nurse practitioner certificate.
When you said you had your own practice, what does that mean?
So in family practice, it would basically be like a family doctor's office. So you see all ages, and it encompasses all health needs of your patients, and you have a set of rostered patients that belong to you, basically.
We're still in a global pandemic. How does COVID-19 impact the way in which you do your job now compared to before?
So when COVID started, I was working in long-term care. There were many challenges. I continued to do in-person care. I had to be in the building physically, wearing all the PPE and taking all the precautions. And along the way, I did transition out of that. And what has changed now is the level of virtual care that we can provide. I think more people are used to receiving virtual care, either by the telephone or video calls. So that's, I think, one of the major changes in our practice. And now I've transitioned to more of a private practice. I think COVID helped me along with that decision.
We've seen a lot of medical professionals who have got COVID. Did you get COVID, or did you?
Thankfully, I have to say no. I was very careful. I do have a family, I have children. So I took a lot of precautions and really, I'm blessed and thankful to have not had COVID.
Mhm. Are you vaccinated?
Um, I'm going to decline to answer that question. I think it's just personal preference. And, there's a lot of, basically, I don't feel comfortable disclosing personal health information. And so I'm going to decline to answer that question.
Today, the government removed the mask mandate. Premier Ford stated that people are tired of COVID-19 measures like mask and vaccine mandate. He stresses that people should be allowed to keep wearing masks if they want to. Will you be wearing your mask, or what's your thoughts on removing masks at this point of the pandemic?
It's a tricky question. I think it's the natural progression. It's where we're at 2 years in. And I do believe it's going to be a slow transition for most people. I think everybody wants to be rid of the masks, but it's going to take a little bit of time to acclimatize now to going into a store or being in a public place with people very close to you and not wearing a mask. So, I think in certain settings, I'm still a healthcare practitioner, so I have to wear a mask in the settings where I practice. So I will continue to wear a mask at some times. And I think slowly, like everyone else, I'll choose when and where I feel comfortable in not wearing one.
Your company focuses on working with various healthcare practitioners. How do you build professional relationship with other healthcare providers, and how important is it to collaborate in patient care?
So it's very important. I think the old model of care where you only had one provider who you saw for everything it has its place. But I think the best model of care that we can provide is by collaborating. And so I think the first step is really understanding what each healthcare provider does, what their practice entails, what's their specialty, and learning how we can work together. I think that takes a bit of time, it takes patience, but if we can really understand each other and see where each of us fits in the puzzle, I think that's the best possible care that we can provide to our patients.
What's the most challenging part of being a nurse practitioner?
I would say not burning out is very challenging. It's, we're invested in our patients' care. We're trying to give the best care. We're working within a system that expects us to give more and more and more all the time. And, our goal of being a healthcare provider is to help people. And so it's very hard to say no to helping someone. It's very hard to set limits on how much you're going to care for a patient or a person. And so a lot of nurses, a lot of nurse practitioners, as well as other healthcare providers, we face that reality of burnout. And I think that's our most challenging piece, is just taking care of ourselves as well.
Do you find that being a nurse practitioner takes more work to do versus being a regular nurse?
I think the difference is the level of accountability. So when you become a nurse practitioner, at first it can be very overwhelming. You suddenly have this accountability more so than a registered nurse, in that you're providing care, you're providing prescriptions, you're giving diagnoses. And so it's a higher level of responsibility. And it takes time to get used to that. It's a little bit intimidating at the beginning.
What role does compassion and empathy play in being a nurse practitioner?
I think it's vital. Honestly, as nurses, we are all nurses before we're nurse practitioners. And so much of nursing is based on understanding another person's situation. And that takes a lot of empathy. It takes compassion to really be where your patient is at, to understand where they are at in their journey and walking with them through their healthcare, through their, sometimes their personal situations. And so it's essential. I think both of those values are essential.
What's your thoughts on technology and the role technology play in caring for a patient? Do you find that, the more technology is used, the less contact you have with a patient? What's your thoughts on technology and patient care?
I think it has its place. It's been a great tool for us. There are so many advances that help us to provide better care, especially in areas that are rural or remote. You'll find a lot of patients who have difficulty getting to appointments, transportation issues. And so technology really gives us the ability to connect with people who are not within our geographical area or who have barriers to accessing care. So I think people fear that we'll all be replaced by technology or it will minimize our care, but in some ways it really does allow us to advance and to reach more people. And so it's a tool. We have to use it wisely.
Have you been exposed to Epic?
No, I haven't.
Oh, you haven't? What's one tip you can give to someone who's considering becoming a nurse practitioner?
So I would say it's very tempting when you become a nurse to rush into becoming a nurse practitioner because, it's more of an advanced role, it's more autonomous, and many people want that. But what I would advise people to do is to get their feet wet, get a good amount of experience in a variety of settings. It really, really does help you when you become a nurse practitioner to have a more rounded practice. And it actually helps with the program as well in, studying to become a nurse practitioner. The more experience you have, the better it will serve you.
So I guess in regards to, it's very similar to being like a family doctor. What are the similarities between what a family doctor can do versus what a nurse practitioner can do?
So the schooling is a bit different. There's a different focus. And so, as I said, we come from being nurses and we're advancing our practice to become nurse practitioners. It's very similar in what the patient will experience. The patient will experience the same level of assessments, the same types of tests we can order. We have some limitations in ordering diagnostic imaging, but that's going to be changing in July of this year. So we will be able to order everything and we can prescribe all medications and provide care. The model of care is a little bit different in terms of, we don't bill OHIP like a doctor would. So our model of care is different. Often with a nurse practitioner, your appointments are longer. You can talk about many different things during your appointment. So the model is slightly different, but the care is essential.
You're watching Health 180 with Carion Fenn and Rogers TV on podcast. My name is Carion Fenn and we'll be right back.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Think it's too late to become more fit? Think again. I'm personal trainer Karen Ross, specializing in 55 plus fitness. My mission is to help you find your way back to health and wellness. I'll give you the knowledge and the power to take control of your own fitness path. Everyone deserves quality of life for their entire life. Tune into A Little Bit Fit with me, Karen Ross, here on Rogers TV.
This is Rogers TV.
Welcome back to Health 180 with Carion Fenn and Rogers TV and podcast. My name is Carion Fenn. We're exploring Ayurveda and Nurse Practitioner. Shan May is back with me. What is Ayurveda?
Ayurveda is an East Indian medical system. So it's a system of healing that comes from India. The word itself translates to knowledge of life. And so it's a system by which we approach each patient as an individual. We get a deep understanding of each person, what their personal constitution is, and how we can best help them to give them an individualized care plan. It incorporates diet, herbs, lifestyle, and different types of body work for helping people with their health issues.
What is the educational background when it comes to Ayurveda?
So Ayurveda, I studied Ayurveda in Toronto at the Center for Ayurveda and Indian Systems of Healing. The Ayurvedic therapist program was about 3 years. So 3 years of in-class learning, practicals, student clinics, and that's the formal part. I would say I'm still a student, I'm still learning. It's sort of a lifelong journey.
How did you first learn about it? And what made you want to get involved in this approach in patient care?
So even as a nurse, I've always been interested in natural health alternatives. I grew up in the Caribbean. We had lots of plants. We grew up with using plants as medicine. And so it was always a part of me. And, as an adult, I decided to explore that further and to become an Ayurvedic practitioner so I could complement my Western medicine schooling.
What are the 3 Ayurvedic body types?
So in Ayurveda, we talk about the elements, and there are 5 elements: space, air, fire, water, and earth. And when we do an assessment for a patient, each patient has a certain dosha or body type. And so the first is vata, which is space and air. The second is pitta, which is fire and water. And then lastly, we have kapha, which is water and earth. And by understanding each person's makeup in regards to these elements, that's how we determined the best course of treatment.
What type of condition can Ayurvedic treatment use to treat?
So there's basically, I would say, 3 streams. One would be preventative. So if you're generally healthy, but you have some ailments like pain, or you have low appetite, or you're working on your weight, like things like that, Ayurveda can help. And secondly, people who have chronic illnesses, so diabetes, arthritis, chronic pain types, Ayurveda can help to support those patients as well. When you get into more acute situations or, terminal illnesses, Ayurvedic is mostly supportive in the West. What we're allowed to practice in Canada is different from what can be practiced in India. So at that point, it becomes more supportive.
Can this be used to help cancer patients?
It's definitely useful in supporting their treatment. So in Canada, Ayurveda is very much used for symptom relief. So if you're undergoing chemo and you have side effects of your treatment, or you want to boost your nutrition, increase the resources of your body as you're going through cancer, Ayurveda can play an important role in that.
Is there side effects?
I think with anything, there are side effects. People often think that natural treatments don't have any side effects, but they do. And there are situations where you would need to avoid certain herbs. You can have digestive side effects, you can have skin related side effects. So it's always best to see a practitioner who can guide you through the use of Ayurvedic treatments.
How can one get educated on it?
As a patient, I would say, there's lots of information online, as with anything, but definitely I would say your best course is to seek out an Ayurvedic practitioner who can really help you to understand yourself and your personal elemental makeup and how to proceed with your daily lifestyle.
Tell us about a first consultation for this type of treatment.
So when someone comes in, firstly, a lot of it is observation. So we observe the person, their overall appearance, the way they walk, the way they talk. There's a lot of that that's involved in just observing subtle characteristics of the person. And then there is a questionnaire that we will go through, which asks a number of questions regarding the person's life and lifespan. And by doing this, we're able to initially just get an understanding of that person's dosha, their makeup in terms of the elements. And that's the first step. And that's the initial. It takes about 1 to 2 hours. It's very long and very involved, but that's where we need to start with any Ayurvedic plan.
What is normally done with the treatments?
So there's a range. The basis of Ayurveda is having a healthy lifestyle. So one is understanding which foods you should and shouldn't eat, which foods should be combined or not combined. It's everything from what time you should wake up to what time you should go to bed, what time you should eat. It's a very detailed sort of daily routine that we go through. So that's the basics. In addition to that, we can recommend herbs for treatment of different conditions and to support digestion or other aspects of health that the patient would be working on. And then there's also body work. So there's Ayurvedic massage and different physical treatments that we can do. And then a huge part of Ayurveda is also detox. So just getting rid of toxins that are in your body by using these various methods.
Is this helpful for individuals who might have issues with arthritis, and how does it help?
It is helpful. When you think about arthritis from an Ayurvedic perspective, arthritis occurs in joints, and within joints, there are spaces. So this is Vata that we're talking about, space and air. And spaces in your body can become very dry, can become very cool. And then what happens after is inflammation. So what we're dealing with is dryness and inflammation. And so we have different techniques, whether it's applying oil externally, consuming healthy oils and fats, having a diet that supports, decreasing dryness within your body. And then when it comes to inflammation, the same. So dealing with your diet and certain types of activities, as well as just taking herbs, for example, turmeric, which can help to decrease inflammation in your body.
What other services does DIA offer?
So DIA is an integrative health team. We have naturopathic doctors with different specialties. So there's general health, there's oncology care, women's health, hormones, digestive issues, the full range of naturopathic medicine. We also have an osteopathic practitioner who provides osteopathy, a holistic nutritionist, cancer coaching, as well as breath work, yoga, and meditation.
What are you most proud about in regards to being a nurse practitioner?
I think the most rewarding part and what makes me feel proud is really taking the time to work with patients and seeing positive outcomes and hearing them come back and say, the advice that you gave me really worked. I followed your advice and I'm feeling so much better. That's the most rewarding thing you can experience as a healthcare provider.
Ayurveda, is that a form of dieting, or is dieting a part of the process?
I wouldn't say dieting, but I would say having the right diet for yourself. So the same foods do not apply to everyone. We often think like, oh, if we all eat salads, we'll all be healthy. But some people should not eat salads. Some people should not eat raw food. Some people need warm foods. Some people need, heavier foods to balance them. Some people need lighter foods. So I wouldn't say it's a restrictive diet, but it's more of choosing a diet that's appropriate for you as an individual.
Mm-hmm. Would you recommend this for anybody to try, or is there a particular age group that would use this type of treatment?
I think it applies to everyone. I think if everyone can access this type of care, it's the beauty of Ayurveda is its simplicity. It's not complicated. It's simply helping you to understand yourself and to choose a lifestyle that suits you to give you the best health possible. So I do think it applies to everyone from children to the aged, and even in palliative care. I think it covers the entire lifespan.
What's one tip you could give to someone who's thinking about trying Ayurveda to help them with their best health?
I definitely would say, find a practitioner that you can work with and be open. It's going to be different. It's not like Western medicine where you're going to be prescribed something that immediately helps you with your symptoms. You have to be open to doing the work, learning, and giving it time. And if you can do that, I think, you get a positive outcome.
And this is something that's utilized to help with pain management as well.
It is, yes. It's definitely.
How does it help in that term?
So in terms of pain management, I think what we don't realize is how much our diet and our lifestyle affects our level of pain, be it physical, mental, emotional. And so the goal of Ayurveda is to bring each person back into balance with themselves. So if you can get back into your correct balance where you're eating right and doing the right activities, in addition to getting body work, in addition to herbs, special types of oil that you can apply to yourself, it's a balanced approach. Nothing is a miracle cure, but it can definitely help to manage all types of chronic pain.
That is all the time we have for today's episode of Health 180 with Carion Fenn on Rogers TV and Podcast. My name is Carion Fenn. Thank you to my guests for joining me today, and thank you for joining me in my effort. Together we're stronger.
Thank you, Carion, for having me.